Understanding Zycubo, a vital treatment for Menkes disease. Menkes disease is a rare and challenging genetic condition affecting how the body uses copper. If your child has been diagnosed, you know the profound impact it can have. Today, we're discussing Zycubo, a crucial treatment offering new hope. What is Menkes disease? Menkes disease is a genetic disorder often passed from mothers to sons. It disrupts the body's ability to properly absorb and transport copper. This is due to mutations in the ATP7A gene. This gene is essential for making a protein that moves copper throughout the body. Without it, copper cannot reach vital organs, including the brain. Many copper-dependent enzymes also fail to function correctly. Introducing Zycubo, copper histidinate. Zycubo, pronounced Zycubo, is a copper replacement product. It is specifically designed to treat Menkes disease in children and adolescents. Zycubo delivers copper directly into the body. This subcutaneous injection bypasses the digestive system, where Menkes patients struggle to absorb copper. Zycubo gained FDA approval on January 12, 2026, marking a significant advancement. Who can use Zycubo? Zycubo is approved for children and adolescents with Menkes disease. It is important to note that Zycubo should not be used to treat occipital horn syndrome. Your healthcare provider will determine if Zycubo is appropriate. The dosage frequency varies by age. Children under 1 year receive Zycubo twice daily, while those aged 1 to 17 receive it once daily. Clinical trial results. A glimmer of hope. FDA approval for Zycubo was based on compelling clinical trial data. These studies showed remarkable survival benefits for treated patients. Early intervention proved especially critical. Children who began treatment within 4 weeks of birth experienced a 78% reduction in the risk of death. Nearly half of these early treated patients survived beyond 6 years, with some exceeding 12 years. Tragically, no untreated patients survived past 6 years, highlighting Zycubo's life-saving potential. Important considerations before treatment. Before your child starts Zycubo, your healthcare provider needs a complete medical history. Discuss all existing medical conditions. This ensures the safest and most effective treatment plan. Your provider will perform several tests. These include checking copper and ceruloplasmin levels, electrolytes, kidney and liver function, and a complete blood count, CBC. These baseline measurements are crucial for monitoring. Administering Zycubo. What parents need to know. Zycubo is administered as a subcutaneous injection, meaning it goes under the skin. Parents and caregivers can be trained to safely give this medicine at home. This empowers families in managing their child's care. For children under 1 year, the dose is 1.45 mg twice daily, with 8 to 12 hours between injections. Children and adolescents aged 1 to 17 years receive 1.45 mg once daily. Your healthcare team will provide detailed instructions. Potential side effects. What to watch for. Like all medications, Zycubo can cause side effects. Common ones include infections, respiratory issues, seizures, bleeding, low blood pressure, vomiting, fever, and dehydration. Injection site reactions are also possible. A serious concern is copper accumulation and toxicity. Your healthcare provider will continuously monitor your child's kidney function, liver function, and blood cells. This monitoring helps prevent and manage potential copper buildup, adjusting the dose if necessary. Always report any side effects to your doctor. Storing Zycubo. Properly correct storage of Zycubo is essential for its effectiveness. Before mixing, store the vials in their original carton in the refrigerator between 36° and 40° to 2° and 8°. After mixing Zycubo with sodium chloride, do not shake the vial. If not used immediately, store the mixed solution in the refrigerator for up to 24 hours or at room temperature for up to 4 hours. Always discard any unused mixed solution after these time frames.